If you have itchy bumps on your hands and arms, ONsalus Health explains the possible causes and what treatment options are available. Atopic dermatitis. Also known as eczema, atopic dermatitis is a very common skin condition. It results in the appearance of small red bumps in the skin, as well as itching in the areas they appear. This condition is linked to the skin's inability to maintain moisture and protect itself from bacteria, allergens, and other irritants. Skin thickening can occur over the long term. Treatment of atopic dermatitis. A trial and error method of treatment is common, often requiring several treatments until the correct remedy is reached. This can include corticosteroid topical creams, oral antihistamines to control itching, and antibiotics in case of infection. Wet bandages can be of great help in relieving the symptoms. Contact dermatitis. Dermatitis is a general term for skin inflammation. Irritation and bumps can appear when the skin comes in contact with chemicals or there's an allergy to certain substances. The pimples will appear almost immediately after contact with the irritant. They can disappear quickly or last weeks at a time. In addition to an intensely itchy rash, dry skin, blistering, swelling, burning, and tenderness may occur. Treatment of contact dermatitis. Treatment of contact dermatitis consists of the application of steroid cream or ointments to soothe the lesions. Oral medications in severe cases can reduce inflammation, such as antihistamines to relieve itching. In case of bacterial infection, the doctor will indicate antibiotics. Dyshidrosis. Dyshidrosis is a skin condition that causes long-term, itchy, fluid-filled blisters on the skin. It occurs in the palms of the hands, fingers, and feet. It often affects people between the ages of 20 and 40. The blisters can reappear before the skin has recovered from previous blisters. Treatment of dyshidrosis. In mild cases, skincare measures should be implemented. When the condition is more serious, the doctor will indicate pharmacological treatment such as corticosteroids, immunosuppressive drugs, phytotherapy, or botulinum toxin injections. Impetigo. Impetigo is a highly contagious bacterial infection that causes itching and pain. The lesions it causes can reach the hands and feet, but the origin is usually around the mouth and nose. The sores start with a red rash, and once they burst, they give rise to brown or yellow scabs. Treatment of impetigo. The doctor will be in charge of indicating the treatment to follow once the diagnosis is made. Antibiotics are usually effective against impetigo. When it comes to minor injuries, the application of topical antibiotics will suffice. If more serious lesions occur, antibiotics for oral use such as amoxicillin and clavulanic acid, some cephalosporins, and clindamycin will be indicated. The treatment period usually lasts for 7 to 10 days. If this video is helping to better understand health issues, consider providing a super thanks to help grow the channel. Psoriasis. Psoriasis is a chronic autoimmune inflammation of the skin that results in the appearance of thick, scaly plaques that are itchy, uncomfortable, and peel off easily. These lesions can appear on different parts of the body, but especially on the hands. Treatment of psoriasis. Treatment is aimed at reducing the number of outbreaks and the severity of the lesions. It will depend on the type and severity of the injuries thus far. The medications to relieve itching and inflammation can be topical, injectable, or oral. Salicylic acid helps reduce swelling, and topical corticosteroids can remove scaly skin. Phytotherapy is another option in the treatment of psoriasis, which consists of the application of ultraviolet light under medical supervision. We share a video above which explains how to treat hangnails, which can be a related condition. Insect bites. The bite of some insects can cause the appearance of red bumps on the skin. These are accompanied by changes in skin coloration, inflammation, and itching. Treatment of insect bites. Insect bites go away on their own. In the event that you suffer from allergies, you may need to take medications such as antihistamines to control the allergic reaction. Otherwise, it will suffice to apply the following: cold water compresses on the bite site, 1% hydrocortisone cream at the site of the injury 3 times a day. If you feel pain, take a pain reliever such as ibuprofen or paracetamol. NUMMULAR eczema. NUMMULAR eczema is a dermatosis characterized by the presence of thickened or leathery plaques in the shape of coins of different sizes. The lesions can appear as a result of atopic dermatitis, dry skin, or even a very cold climate. This alteration frequently affects the hands, legs, feet, and abdomen. Erythema, papules and vesicles, as well as thickened scabs, are initial symptoms. The itching caused by these lesions is intense and can be very aggravating. Treatment of NUMMULAR eczema. The skin should be cleansed with soap substitutes and bath oils with the application of emollients 2 times a day. During the eczematis phase, heating pads should be applied with subacetate of lead and distilled water in equal parts. Glucocorticoids are applied locally with great care depending on the degree of inflammation. If the existence of an infection is suspected, antibiotics such as procaine penicillin or dicloxacillin will be indicated. Lichen planus. This is a disease that causes pimples, swelling and irritation of the skin of the hands and other parts of the body, especially the forearms, wrists and ankles. Some cases can be managed at home, others will require medical treatment. Treatment of lichen planus. Lichen planus can go away on its own in a few months or even years. However, the doctor should initiate treatment and monitor the lesions. They'll also indicate corticosteroid cream or ointment. In case the pimples are severe, treatment will be required orally or through an injection. Antihistamines may be prescribed to relieve itching, along with medications that suppress or modify the body's immune response. Phototherapy can also help the disappearance of this condition. Scabies. Scabies is an infestation caused by very small mites. They settle on the outer layers of the skin, causing itching and a rash. The itching usually occurs at night. The mites prefer places like the spaces between the fingers of the hands, palm of the hands, creases of the wrist, elbow, knee, head, face, neck, and even the waist. Infestation occurs from prolonged skin-to-skin contact, allowing the mites to crawl from one person to another. Occasionally, it can be caused by sharing personal items such as bedding or towels. Treatment of scabies. The treatment consists of the application of medicines to kill the mites. Topical creams or lotions are applied throughout the body, especially in the areas where the lesions are found. They are left to act from 8 AM to 2 PM and then they are removed. Treatment can last up to 3 days depending on the medication used. Here is this ONsalus Health video on the 9 reasons that can cause burning and the appearance of pimples on the hands. If you want to continue learning about other ailments, don't miss the playlist we share here. Leave us a like and write your doubts or suggestions in the comments. We'll see you next time.